After living in Aberdeen for nearly 3 years, we returned to Christchurch, where my husband was in a parish as a parish minister, and we lived in Burwood. So I applied to Burwood Hospital to work shortly after arriving in New Zealand, back in Christchurch. I was put into the geriatric wards, and I have to say I was very, very unhappy there. As you can imagine, I had been working in a professorial surgical intensive care and thoracic surgery, and then to be put into a geriatric ward, it wasn't my idea of physiotherapy. But fortunately, very soon after that, I was put into plastic surgery, which is where I worked for 5 months. I only worked for 5 months because I was pregnant and I had my 2 children in New Zealand. Perhaps one thing that while I was in the geriatric ward, I did put into use my bow bath therapy that I had learnt in Aberdeen. One of the things I forgot to reflect upon when I was in Aberdeen was Rosemary Lane, the principal of the School of Physiotherapy, was a bow bath teacher, and she always ran a bow bath course every year for adult rehabilitation. And I do recall that every person who wasn't Aberdeen trained had to do her bow bath course. And so it was not only bow bath orientated, but also we did a lot of PNF and of course I was well versed in PNF, having been a graduate of the 1960s. So between adult bow bath techniques and PNF, that was I was well versed in the techniques of the era of Rosemary Lane and for neurorehabilitation. One last memory I have of Aberdeen was having on my first day and working at Aberdeen Royal Infirmary, having to work with a young lad who was 17 years old, who had had a head injury and had been left with quite a dense right hemiplegia. And he spoke in very, very broad Scots accent, and I had no idea what he was saying. But he kept saying to me, my back's sore, and I had no idea. I looked to my other therapist in the therapy gym and said to him, what's he saying? And they say, oh, he's got a sore back. One of the challenges of working in Aberdeen was learning what the local was saying, and because they spoke quite a different dialect from anything that I was learnt. I certainly got accustomed to listening to the dialect, but I could never speak it. Which reminds me, also working, although I worked in the thoracic ward, or the thoracic and professorial unit, we all had to help every day in what we called the hippie unit. Every day at 11 o'clock, all physiotherapists in the entire hospital would descend upon the hippie unit, where these wee mannies and these wee wifeys who had broken femoral heads, we would mobilise them, and all the physios, which was probably 10 or 12, would arrive, and we'd two each to each of these patients, and we'd mobilise the patients. The other area that I did have to do also was teaching maintenance exercises in the orthopaedic wards. Many of the young men in the orthopaedic wards with fractured femurs had been injured either on the oil rigs, because there was the oil boom, or they had been injured on fishing boats. Of course, many of them spoke in very, very broad accents, of course, which I had no knowledge of when I first went there. And I do recall you would pull the curtains around. They were in long wards where there'd be 20 or 30 of these people in the wards, and you'd pull the curtains around the bed and do their maintenance exercises. And all the other, of course, young men didn't have much to do, anything to keep them entertained, because they were in Thomas Splint's and traction for 3 months. And to taking the mickey out of this New Zealand physiotherapist was one of their favourite activities when we were doing maintenance exercises. Back to Christchurch. In Christchurch, I worked in the burns unit and the plastic surgery unit, where I don't think there was anything outstanding there. I've spoken a little bit about it previously. And then I had my children in Christchurch. After I had my children, I continued to work as a physiotherapist, just very part-time. I did a locum in the burns unit when my children were, well, my daughter was 16 weeks old. But I also did antenatal classes, and that's when I started doing a little bit of women's health, just doing antenatal classes. I was the physiotherapist for the Plunkett Society, and I used to take the antenatal classes in the Plunkett Society, and I did that for the entire time that I was in Christchurch, which was about 3.5 years. First of all, one child was born, and then my next daughter was born 2 years later, and my daughter would often come with me to the antenatal classes, which the mothers really appreciated, because after I did the antenatal classes, they would have teaching classes, and the Plunkett nurse would use my baby as the model for baby bathing or whatever.